Good evening and thanks for joining us. We are watching the spread of the new coronavirus again tonight and the potential impact on you. There are now 54 confirmed and presumptive cases in Canada, including another new case in Alberta and 2 new ones in Ontario. We're also watching that cruise ship stranded off California with 235 Canadians on board. Test kits were airdropped to that ship by helicopter because a man on a previous voyage died of COVID-19. And late this afternoon, the American vice president announced 21 people on board have tested positive. 19 are crew members, but only 46 people of the 3,500 people on board have been tested at this stage. And right now, none of them are going anywhere. Back here in Canada, there is now at least 1 case of community spread in BC, a woman infected with COVID-19 who has no link to travel from a country where there's been an outbreak. BC's public health officer says the woman's every move in the last 2 weeks is now being traced.
We want to know everybody she's been in contact with since she developed symptoms. We go by day. You know, where were you here? How did you get there? We do all of the details. Did you go by bus? Did you take a private car? Those are all things that are being investigated in detail.
She says that rapid, detailed response and lots of testing means the virus is being contained in Canada. Of the 54 confirmed and presumptive cases here now, most are in BC and Ontario, where there are 2 new cases. One is a man in his 20s who was in Italy. The second is a woman in her 60s who got back from Iran. Both are now in self-isolation. Quebec now has a 3rd case, a presumptive one. It's a man who was recently in France, where he believes he caught the virus from someone he knows. And there are 2 presumptive cases in Alberta. One was just announced, a man in his 40s in the Edmonton area. He just got back from the United States. The other case is a Calgary woman in her 50s. She's a former passenger from the Grand Princess cruise ship. She was also a worker at ATB Financial, and now 2 of its branches in Calgary are closed. Testing here in Canada has ramped up much faster than in the U.S. BC and Ontario have their own tests now, and capacity at labs is being increased. The federal government has committed $27 million now to fund coronavirus research. There's also a plan to support Canadians who are in quarantine or self-isolation and unable to work. David Akin in Ottawa has our top story tonight. David?
Well, Donna, public health officials from across Canada knew this day was going to come. The first case of a COVID-19 infection by an individual with no history of travel.
It was not unexpected, certainly something that we are prepared to deal with, and the detailed investigation, the resources that we need to put into that are ongoing right now.
Now, the painstaking medical detective work as BC officials try to retrace what that patient did and where she went for the last 2 weeks.
There are a number of public events. There's a number of places that she's attended. There's her workplace.
But the message from the BC government, the risk remains low, and detailed plans are in place to manage a major COVID-19 related disruption that could last as long as 4 months. The province's pandemic planning covers everything from making sure grocery stores have enough food to rapidly moving healthcare workers to where they are needed.
So we are currently and clearly in the containment phase, but it is our responsibility and the Premier's direction that we have been preparing for a month for a more serious situation as it develops.
BC's pandemic plan, like all provincial pandemic plans, adheres to federal guidelines set out in the Pan-Canadian pandemic plan.
The federal government actually provides technical advice and support to provinces to make those decisions, but it is the decision of the jurisdiction.
Meanwhile, the federal government is spending $27 million for 47 different COVID-19 research projects across the country.
Today is a significant investment, but it's important to note that if additional resources are required, we are willing to step up and provide those additional resources.
And that money will help Canadian scientists join the international search for a vaccine. Scientists here are also trying to figure out questions like, how long does the virus persist on surfaces or in the air? And those answers could be crucial in the fight to prevent more COVID-19 infections in Canada. Donna?
All right, David Akin in Ottawa, thanks. Financial help is being planned for Canadians who are required to self-isolate or be in quarantine and are unable to work. The federal finance minister is working on that. Our Ottawa Bureau Chief Mercedes Stephenson spoke with Bill Morneau. Mercedes, what's he saying?
Donna, Finance Minister Bill Morneau says Canada has the fiscal firepower to deal with the COVID-19 shock, but still he's preparing to shore up the Canadian economy. The Finance Minister promised support for those who could be hardest hit economically, Canadians without paid sick leave and industries that are expected to bear the fallout, like travel and the service industry, as well as the oil sector. We asked him just how much the new coronavirus could hurt the economy and how much money the government is expecting to have to spend on health care and those fiscal backstops. The short answer is they don't know. It depends on how bad things will get and therefore how much it will cost. Listen to this.
I really can't give you a scope. The challenge really very much depends on the depth and the duration of this challenge around the coronavirus. It also depends on the geographic spread. And so we will only know that as the facts become available.
Mercedes, what did Morneau say about how this might change the federal budget that's going to be released, we expect, sometime later this month?
Well, Donna, Morneau was cagey on when the budget might come down, but so far there's no expectation that COVID-19 has shifted the traditional timeline that would see a budget in the next few weeks. The finance minister revealed the government will pad the risk adjustment provision in the budget. That's the federal government's contingency fund, a safety for unexpected events like COVID-19. But other than that, COVID-19 spending is expected to be outside of the federal budget rather than included in it. Donna?
All right, Mercedes Stephenson in Ottawa, thanks. And you can watch the full interview with the finance minister on Sunday on the West Block right here on Global. In the U.S., the number of cases has jumped past 270 now, and at least 15 people have died. New York City is pleading for more test kits. The health department says it will quickly run out. The U.S. is now also grappling with what to do about people on board that cruise ship that's off the coast of California. We just learned 21 people on board have tested positive. Jackson Proskow has that story.
Off the coast of California, more than 3,500 passengers and crew aboard the Grand Princess are stuck in limbo. 235 Canadians among those now confined to their rooms, including Ian Lancaster Graylish from Toronto.
And they'd said everything was canceled. All the bars were closed. The restaurants were closed. And we'd be having room service tonight.
The COVID-19 test kits airlifted to the cruise ship Thursday ended up delivering grim news. 19 crew members and 2 passengers on board tested positive after 5 passengers from the ship's previous sailing tested positive and 1 died.
All passengers and crew will be tested for the coronavirus. Those that need to be quarantined will be quarantined. Those that require additional medical attention will receive it.
In the U.S. Capitol, President Donald Trump signed an $8 billion emergency spending bill.
I think we're in great shape.
Before touring the Centers for Disease Control, where he downplayed the risks of coronavirus.
Most of those people are going to be fine. A vast majority are going to be fine.
And claimed to be an expert on the subject.
Every one of these doctors said, how do you know so much about this? Maybe I have a natural ability.
A botched rollout of testing kits has left the U.S. with an unclear picture of how far and wide COVID-19 has spread. The number of infected continues to grow daily. So does the death toll. At this nursing home outside Seattle, where several residents have died, families are demanding answers.
My mother, I got a phone call this morning that she passed at 3:30 in the morning.
Pat Herrick was told her mother Elaine died of natural causes overnight. She wonders if it wasn't the virus that has swept through the care facility.
I'm asking and lobbying to make sure she gets tested. I want her body tested. And I've been told, well, we don't do that. You know, we just have to assume that it's natural causes. And so I'm saying it's not okay.
The U.S. admits it still doesn't have enough coronavirus test kits to meet demand, and that's a real concern. The number of deaths compared to the number of cases identified suggests there are far more cases out there than currently reported. Donna?
All right, Jackson Proskow, thanks. What's happening in Italy is a sign of what this virus can lead to if not contained. Italy recorded its highest daily death toll from COVID-19 today. 49 people in Italy died today of the virus, and the number of deaths in total in Italy is now 197. There are sweeping restrictions on public gatherings there to try to limit the spread. As of tonight, more than 4,600 people have have tested positive in Italy. Well, the nightmare is finally over for a group of Canadians quarantined because they were on board the Diamond Princess ship in Japan. More than 100 former cruise ship passengers finally made their way home today. The group spent nearly a month in quarantine, first on board the Diamond Princess and then at a hotel in Cornwall, Ontario, to ensure that they are virus-free. None have developed any symptoms.
I'm so glad we're in Canada, and I'm so glad we're on our way home. One more flight.
More than 700 other Diamond Princess cruise ship passengers, including 50 Canadians, did test positive for COVID-19. 6 of them have died, though none of them were Canadian. We know you have lots of questions about this virus. We want to help answer them. You can send an email to your questions at globalnews.ca, and our Jeff Semple will consult experts to find the answers. You'll also find extensive information on our website. We have a special page dedicated entirely to the new coronavirus. That's at globalnews.ca/coronavirus.